All righty. Good morning and welcome to today's 2021 Medicare Update presentation, another in a series of Medicare educational sessions sponsored by the Milwaukee SHIP Collaborative. I am Michelle Allison, the Information and Outreach Coordinator for the Milwaukee County Division on Aging. The Milwaukee SHIP Collaborative brings together federal, state, and local agencies to provide you with timely, accurate, and unbiased information about Medicare, Medicare Cost Assistance, Medicare Appeals, and Medicare Fraud Prevention. This presentation is made possible by support from the United States Administration for Community Living through the State Health Insurance Assistance Program and the Medicare Improvements for Patients and Providers Act program, and the Wisconsin Department of Health Services through the Elder Benefit Specialist program. A special thanks to today's principal presenter, Amos Besaw, the Benefit Specialist Supervisor with the Milwaukee County Disability Services Division. Thanks to all of you for taking time to attend this educational session with us. During today's presentation, you will learn about the different parts of Medicare, how to enroll in and review your Medicare and prescription drug plans, financial assistance that may be available to assist with Medicare costs, with a special spotlight on special circumstances of Medicare eligibility. This is only a basic overview to help you better understand Medicare and to encourage you to review your plan during the open enrollment period. This presentation does not constitute legal advice, and each individual situation is different. No insurance company sponsored this program, and the information provided is about Medicare generally without any preference for specific plans. The Milwaukee County Division on Aging assists Medicare eligible residents to enroll in Medicare plans and to resolve issues when using Medicare benefits. You can contact our Medicare benefit specialist by calling the Milwaukee County Aging Resource Center at 414-289-6436. Today's presentation will be recorded. During the presentation, please mute your phones by pressing *6 or by clicking the microphone icon on the bottom of your screen. You will have the opportunity to ask questions at the end of the presentation or by typing a question into the chat box, accessed by clicking on the speech bubble icon on the bottom of your screen. Now I am pleased to introduce today's presenters. And Dan Idrikowski, State Health Insurance Assistant Program Coordinator for Milwaukee County, Nina Yang, Elder Benefit Specialist for Milwaukee County, and Amos Besaw, Disability Services Coordinator for Milwaukee County. Dan will start us off with a brief overview of Medicare and the Medicare enrollment process.
Great. Thank you so much, Michelle. I'm pleased to be here today, and thanks everyone who is joining us or listening in later on this recorded version. We are pleased to present this in concert with a host of partners in Milwaukee County, and today's special focus on special circumstances eligibility, particularly for our residents with disabilities here in Milwaukee County. As Michelle mentioned, this is part of the state health insurance program, and the information that we'll provide you today will be unbiased, and you are always free to contact us to get more information or to assist you with enrollment or with issues that arise during the utilization of Medicare. What is Medicare? Medicare is health insurance for people who are 65 and older. and for individuals who are under 65 with certain disabilities, and for individuals at any age with end-stage renal disease. Medicare is administered by the Center for Medicare and Medicaid Services, or CMS, and initial enrollment is conducted by the Social Security Administration, or for railroad retirees by the Railroad Retirement Board.
And then Dan, can you share your screen?
I thought I had. I am so sorry. So Medicare consists of four major parts. Original Medicare consists of Part A and Part B. This was the original manifestation of Medicare when it was passed in 1965. And that includes hospital insurance, so insurance that covers you when you're an inpatient admitted to a hospital or nursing home facility. And Part B, medical insurance. This is the traditional healthcare that folks are used to for emergency room visits, outpatient therapy, etc. Part C was added later and is also known as Medicare Advantage, and provides private health insurance companies with an opportunity to offer Medicare approved plans. They contain all the coverage that is available under Part A and Part B. And they may add additional coverage. Usually Medicare Advantage plans include Part D, a prescription drug plan, and sometimes they include other benefits. We'll talk more about them in just a minute. And then Part D is the prescription drug plan, and that plan is optional. That was the last part of Medicare to be added. And there you can choose a prescription drug plan. These are also private insurance plans, which are additional to traditional Medicare. In Medicare, you basically have two major coverage choices. Either you can choose to stick with original Medicare coverage with Part A and Part B, and with original Medicare, then you have the opportunity to add a prescription drug coverage through Part D, as we mentioned, and you can also add a Medicare supplement or Medigap policy. And the reason that those are private insurance policies, they are not part of Medicare, but what they do is help to supplement the payment structure so that, as we'll talk about in a minute, the costs under original Medicare could be covered. Your part of the costs of Medicare would be covered through a supplemental plan. Original Medicare is accepted anywhere in the United States and its territories by any provider, and you can see any provider who is Medicaid certified. Generally, you don't need special permission from a primary care physician, for example, to see a specialist under original Medicare. Your other choice, your other major choice, is to go with the Medicare Advantage plan. And Medicare Advantage plans, again, combine Part A and Part B, and usually have a prescription drug plan as well, and may have some other benefits included in them. However, their cost structures can be different, can vary from original Medicare in terms of coinsurance and copay. And generally, most Medicare Advantage plans are either HMOs or PPOs, health maintenance organizations, or preferred provider options, or some variation on that, where there is a closed network of providers that you will need to choose from. And if you go outside that closed provider network, you will either pay a higher premium or a higher fee or a higher coinsurance, or you might not get coverage at all under the plan. That is the major difference between the two plans. Unlike original Medicare, however, Medicare Advantage plans do have an out-of-pocket cap. So there is that advantage as well. So as we mentioned, Medicare Part A hospital insurance covers inpatient hospital care, semi-private room, skilled nursing facility, rehabilitation. So this is after you are admitted as an inpatient to the hospital and you need rehabilitation at a nursing home or a rehab hospital. Medicare Part A will pay for that as long as you've been as an inpatient for 3 days. Now that is waived during COVID-19, but we expect that that requirement will probably come back after the public health emergency ends. So an important thing to remember is that Medicare is not long-term care and does not cover long-term care stays in a nursing home. And we'll talk just a bit about that in a moment. Part A also covers home health services that are and that emanate from the reason you had a stay in the hospital, and hospice services. All hospice services are covered under Part A. This is end-of-life care when two physicians certify that you have less than 6 months to live. There are costs associated with Part A. As you see here, there's a $1,556 deductible for the first 60 days with hospital coverage. Usually that's met in the first day that you're in the hospital. And there may be additional costs in the hospital after 60 days. For nursing home stays for the first 20 days, that's completely covered. And then there are costs for days 21 to 100. And after the 100th day in the hospital, you would be on your own to pay the full cost of that nursing home stay. There is an exception for that, which we'll get to later, if you have a supplement policy in Wisconsin. Medicare Part B, as we mentioned, covers medical services, general health care, so physician services, outpatient hospital, ER, labs, occupational and physical therapy, mental health services on an outpatient basis, durable medical equipment, preventative services like screenings or a flu shot, and annual wellness, though not a full physical, and ambulance transportation to the hospital or a skilled nursing facility. Again, during the public health emergency, all of the COVID-19 testing, the vaccination, the booster shots are all completely covered for 100%. There's no copay or co-insurance. You should not be contributing anything towards the cost of those services. And in many cases, telehealth has been expanded, so it's either fully covered or there's a small, it's available and there's a small charge depending on the nature of the visit. As we mentioned, Part B has additional costs. So with Part B, there's an annual premium in 2022, beginning in January. That premium will be $170.10. And generally that premium is taken right out of your Social Security check. You can choose to have it paid that way. Most people do that. And you pay that Part B premium whether you are in original Medicare or you are in a Medicare Advantage plan. In original Medicare, you also pay a yearly deductible of $233 and 20% coinsurance for most services. And there is no, unlike Medicare Advantage plans, there is no cap on the total out-of-pocket costs that you could pay. So this 20% co-insurance, along with the premium and deductibles and maybe co-pays, could add up for you if you had a major illness. So in order to assist with these costs, there are some programs that are available, such as the Medicare Savings Program through Medicaid, which can help to cover the cost of the premiums and sometimes the co-pays and co-insurance as well. And those are income-based programs. And it's always good if you're struggling to afford your Medicare coverage to check to see if you might be eligible for the Medicare Savings Program. What's not covered by Medicare? Routine physicals. So please ask for your annual wellness check. Most dental care and dentures, hearing aids and fitting exams, routine eye exams, most cosmetic surgery, massage therapy, acupuncture, and as we mentioned, long-term care. So long-term stays in a nursing home or assisted living facility are not covered by Medicare. Okay, at this point, I am going to turn it over to Nina Yang, who is our elder benefit specialist for Milwaukee County, and she's going to talk to you a bit about Medicare Advantage. Nina?
Thank you, Dan. So I'll discuss about Medicare Part C, which is Medicare Advantage. And Medicare Advantage are a private health insurance plan. You have the option to purchase this plan, and it's another way to get Medicare coverage. And they also have to follow the same rules as original Medicare. They just have different cost structures. And in order for you to enroll in a Medicare Advantage plan, you must have Medicare Part A and B. And with Medicare Advantage plans, majority of the plans may offer prescription drug coverage included with the plan as well. And they may have extra benefits like vision and dental. However, with these extra benefits, you do have to be careful with the type of coverage that is offered through the plan. And with the plans as well too, they are provider network, like Dan mentioned, PPOs and HMOs, and you may have an additional premium to these plan as well too. And there's an annual out-of-pocket limit, which can help you with your budget of the cost of your care for that year. Next slide. So Medicare Part D is Medicare prescription drug coverage, and this is optional if you choose to enroll. If you do choose to enroll in a Part D drug plan, you have to be in Part A or Part B, and in order for you to enroll, you will purchase a Part D drug coverage through a private insurance plan, and you can choose to join the plan as well too. And plans have their own formularies as well, and their regional service areas. And you may have a monthly premium as you enroll in a Part D drug plan, and you pay for deductibles, co-insurance, and co-payments. There's a program through Social Security Administration called Extra Help that can help pay for Part D drug costs, and is based on income and resources for you to qualify for that program. So senior care is offered in the state of Wisconsin, and this is a Wisconsin prescription drug assistance program for individuals who are 65 and older. And senior care is able to negotiate price at a lower cost through pharmaceuticals. And for generic drugs, it's $5. For brand name drugs, it's $15. And then depending on your level of income, that would determine whether or not you have to meet a deductible. And if you have a spend down that you have to meet initially, if your income is higher. And senior care is considered considerable drug drug coverage as Part D, and to enroll, you can call the Senior Care Helpline at 1-800-657-2038. So what is the Medigap policy? So individuals who have original Medicare can choose to enroll in a Medigap policy, and it may all depend on when you should enroll as well too. But overall, Medigap policy are sold by private insurance companies, and they are not part of Medicare. And the best time to purchase a Medigap policy is during your guarantee issue, and that's within 6 months of your Part B enrollment and 60 days after you have lost other coverage. And that can include like employer coverage. And then as well, they are guaranteed renewable. And with the policy, they fill in the gaps of original Medicare. So it pays for the Part B 20% co-insurance. It can pay for the deductibles and co-payments. It also can provide coverage for travel outside the United States. And in Wisconsin, additional coverage is provided for a chiropractic and skilled nursing facility. So Medicare enrollment. So for enrollment, you are automatically enrolled in Medicare if you're receiving Social Security retirement benefits or Social Security disability benefits. It is not automatic if you are age 65 and still actively working. If you are, it is important that you do check with your HR to determine how Medicare will work with your employer insurance. As well too, if you're not receiving any Social Security benefits, it's not automatic for enrollment. So make sure you do consider to enroll in Medicare Part A or both A and B. So for Medicare initial enrollment period, this will determine when your Part B coverage will begin. So if your birthday is in April, you have 3 months before you turn 65 to enroll, which would be January through March. And your Part B coverage will start the month that you reach age 65. And then if you enroll during the month of your birthday in April, Part B will start 1 month after you reach age 65. If you enroll 1 month after you reach 65, Part B will begin 2 months after the month of enrollment. And if you enroll 2 to 3 months after you have reached age 65, Part B enrollment will begin 3 months after the enrollment month. So if your birthday falls on the first of the month, your initial enrollment period will be different, and that will begin 1 month and end 1 month earlier. As well too, if you decided to not enroll in Medicare during your initial enrollment period, you have the general enrollment period from January 1st to March 31st to enroll in Medicare, and Medicare benefits will now start until July 1st of that year. And then you may have special enrollment periods where you can receive Medicare the next following month, depending on when that circumstances. So how to enroll in Medicare? So individuals will enroll in Medicare through Social Security Administration, and you could call their toll-free number or the local office number, and the toll-free number is 1-800-772-1213, or you could go online on SSA.gov, or you can mail in your application to the Social Security office. And if you are a retired railroad, you can call the local railroad board office, or you could call the 1-877-772-5772 number to enroll in Medicare. And also due to COVID-19, Social Security offices are closed, and it's best that you complete your Part B enrollment online. So here's an example of what your Medicare card should look like once you are enrolled in Medicare. It'll state your name, your Medicare number, as well what you are entitled to, and the dates of when the coverage are to begin.
Now, Nina,
Mhm.
before we move on, in terms of enrollment today, we're going to be talking about special circumstances eligibility. If you're a person with a disability, do you have to affirmatively enroll, or do you need to wait till you're age 65?
So if you're on disability, you will wait until the 24th month of your eligibility, but that's only based on SSDI. But if you're on SSI, that eligibility for Medicare won't start until you turn 65, and that's usually automatic through Social Security.
Thank you.
You're welcome. And right here is the Medicare website for Medicare.gov. This can be a useful resource for you as an individual if you want to learn more information about Medicare. And then the next slide will show you a screenshot of how you can sign up for a Medicare account. You put in your information on here along with your Medicare number. And by creating an account, you can access information on any claims. You can also print out your Medicare card if you have lost that, and also gather other information regarding Medicare. And right here is the Medicare Plan Finder. So anyone who's interested in looking at Medicare Advantage plan or Medicare Part D drug plans can go on this website on Medicare.gov, and you can look for 2022 plans. And it's easier if you continue with logging in so that your information is saved. If you don't log in to create an account, you can continue without logging in. And with that, you'll have to input everything from prescription on there, as it won't auto populate, but that's also a choice for you to do as well. And then I will turn this over to Amos, who will discuss about special circumstances and eligibility. Thank you.
Thank you, Nina. So my name is Amos, and I'm the Disability Services Coordinator with Milwaukee County. And I was going to be talking about some special circumstances for eligibility to get Medicare for people that are under 65. So the first one we have is amyotrophic lateral sclerosis, ALS, also known as Lou Gehrig's disease. Then there's end-stage renal disease, supplemental security income, known as SSI, Social Security Disability Insurance, known as SSDI, and then different special enrollment periods that people may be eligible for. So we'll start with ALS, Lou Gehrig's disease. It's a progressive neurological disorder which results in weakened muscle and muscle deformity issues. If you've been diagnosed with ALS, you are eligible for automatic enrollment to Medicare. The first month, you're entitled to Social Security Disability Insurance or railroad disability benefits through the Railroad Retirement Board. And that's subject to a 5-month waiting period before the disability benefits actually begin. Then there's end-stage renal disease and Medicare eligibility related to that. The individual must be under 65 years old and have a diagnosis of end-stage renal disease or permanent kidney failure that requires either dialysis or transplant. The doctor performs a glomerular filtration rate test, which is known as GFR, to measure the actual kidney functioning. The diagnosis comes from the test or the functioning that shows the permanent kidney damage. You also have to have enough work credits to be eligible for that. And individuals can use family members' work history to qualify for end-stage renal disease Medicare. 40 working quarters or 6 working quarters in the last 13 quarters is the eligibility component to that. And then in order to enroll into it, you need to contact Social Security, and then there's the national telephone number is listed on the bottom here. All right, so end-stage renal disease enrollment. The individual must be actively enrolled in end-stage renal disease Medicare, and you do that by contacting Social Security, or at this point, you can't contact the local field office in person because they're all closed due to the COVID. And that applies to the railroad workers who receive benefits from the Railroad Retirement Board, which isn't a lot of people, but it does apply to some. And then doctors or dialysis centers sends paperwork to Social Security to verify that they have the diagnosis of the end-stage renal disease. All right, so when does the end-stage renal disease Medicare start? So there's different types of treatment that can determine when the individual is eligible to enroll in the end-stage renal disease Medicare program. So the different types of treatment are if they're inpatient or getting outpatient dialysis, it starts the first day, the 4th month of getting the dialysis. A side note is there's a 3-month waiting period. When the first month the individual receives dialysis, even if the individual decides not to enroll in Medicare on the 4th month or when they're eligible for it. Then there's home dialysis, which that should begin the first day of the first month of the training program. And then a side note to that is the doctor expects that the individual can complete the training program to be able to do the home dialysis on their own or with some assistance. And then the last component on when it could start is if they're getting a kidney transplant. So starting the month the individual is admitted to Medicare approved hospital for a transplant or for the healthcare setting that they're in. And then the individual must receive a transplant within the first 2 months of beginning coverage. So enrolling into renal disease Medicare, the individual should enroll into Part A and Part B at the same time. And they can enroll into Part B and Part A at any time. Part A is retroactive up to 12 months. And a note, they cannot start before the individual was eligible for end-stage renal disease Medicare. And then the Part B enrollment is connected to the Part A enrollment, and Part B can also be retroactive. If Part A is retroactive for more than 6 months, the individual can choose to have the Part B begin the month they submit the application. Someone may not want to retroactively enroll into Part B because they would owe premiums for retroactive coverage. So if something like that happens, contact a SHIP counselor or a benefits specialist to get some more detailed information. I don't know if I froze, if you can move on to the next slide, Dan.
Amos, I'm sorry, before we move on, if you could just talk briefly, you'd mentioned earlier that family members' work credits could sometimes be used to help an individual to meet the work history requirement, the work order requirement to enroll in Medicare benefits. How does that work?
Yep, if someone has been working and they don't have enough credits on their own record, they can potentially be eligible to still enroll into the end-stage renal disease program using the benefits off of a spouse's record generally. And the spouse or the family member would have to have enough earnings or credits on their record in order for them to be eligible to enroll into the renal disease Medicare program.
And they would have to be living in the same household, is that correct?
Yeah, generally they have to be residing together.
Okay, thank you, Amos.
Yep, you're welcome. And then end-stage renal disease treatment covered by Medicare includes kidney transplants, immunosuppressant drugs after kidney transplants, as long as the individual has Medicare at the time of the actual transplant. So those are also covered. If they are hospital inpatient and getting dialysis, otherwise, if they're outpatient dialysis for Medicare, by a certified hospital or free standalone dialysis facility. And then also includes home dialysis training and equipment from a facility. This is training for any individual or caregivers that would be helping with the dialysis, the home dialysis equipment or supplies that are needed to go along with that. And then also medications or the immunosuppressant drugs that are related to the treatment. And then Medicare also covers usual Medicare covered services and items unrelated to the end-stage renal disease Medicare program. And then a little bit about supplemental security income. Supplemental security is designed to supplement the income of low income and asset individuals. The Medicare enrollment is usually automatic. I think like Nina said, it would be at age 65. And then there is extra help. Enrollment is automatic to lower the prescription drug costs. So it helps keep the cost of medications down. And then there is assistance to help pay for the Part A and Part B premiums. And then those are done through various Medicare savings programs. The different Medicare savings programs each have different income limits. And they do also have an asset limit, but if someone's getting SSI, they should already meet that asset eligibility part of it. And then there's Social Security disability insurance. The SSDI determination is based on someone having enough work credits or work history to be eligible for the SSDI program. The Medicare enrollment is automatic for that. And then the initial enrollment period begins 3 months before your 25th month of disability benefits taking effect. And the last part is about different special enrollment periods that someone may be eligible for. So when there's certain life events that happen, you can look at making changes to the Medicare plan that you're enrolled in. This includes changes to where you live. So if you move cities or regions, you might be eligible for a special enrollment period. If you lose current coverage, that could be through an employer or private plan, I guess. If you have a chance to get other coverage, if your plan changes its contract with Medicare, and then also other special situations such as someone being eligible for both Medicare and Medicaid at the same time, or if they may qualify for extra help, or if they dropped a Medigap policy the first time and they wanted to join an Advantage plan. Those get a little bit more detailed if you're eligible for a special enrollment period. So the best thing to do would be contact either a SHIP counselor or a benefit specialist with the county, and then they can go over some of that detailed information with you. Did you want me to cover this too, Dan, the Medicare Appeals?
I can jump in at this point again.
Oh, okay.
Great, thank you, Amos.
Yep, thank you.
So as Amos and Nina both mentioned, there is assistance available through the SHIP program for you if you have either difficulty with enrollment or difficulty while you're using the Medicare program. If you're denied a benefit or particular coverage issue, if there's a payment discrepancy, et cetera. And it's important for you to, even once you are enrolled in Medicare, to pay attention to your Medicare notices that will come to you that explain the coverage that you're receiving under Medicare. There is an app that Medicare provides that lets you know what is covered, and sometimes you can use that app to check to see if the item or service that you're looking for is actually covered by Medicare. But most importantly, you should review your notice of benefits or your your benefit notice that lets you know what has been covered, what might be your anticipated cost share, et cetera, to make sure that items that should be covered are covered, that there's not something on that bill that you didn't request or you weren't treated for. And for all those kinds of circumstances, you have appeal rights. There's multiple levels of appeal in Medicare program. And there's also a special appeal process through a third-party intermediary. If you are discharged from a hospital or a skilled nursing facility or about to be discharged, and you don't feel that that discharge is going to be appropriate, you can appeal that immediately, and you will be allowed to stay until a decision is made, which usually will happen within 24 hours. And you can also make quality of care complaints through this helpline as well. So for both those discharge appeals and quality of care issues, you can call the Levanta helpline at 888-524-9900. Otherwise, we encourage you to contact Senior Law at Legal Action of Wisconsin, who have elder benefit specialists through Milwaukee County's Older Americans Act program and the State Elder Benefit Specialist program. And they can help review your rights under Medicare, assist with an appeal or complaint. And their intake line is 414-278-1222. Okay. There is help for people with limited income and resources. And I am going to ask if Ginger Rogers would be available from Disability Rights Wisconsin to cover this portion of the presentation.
Yes. Oh, wait a minute. Just a second. Yes, Dan, I can assist you with that. So no problem. To get myself together. Okay. For those who have lower incomes and resources, there is help available for them to get to help pay for Medicare related costs. A lot of people who have lower income and resources may have Medicaid, sometimes called medical assistance, sometimes called Title 19, sometimes called Badger Care, that people can enroll in to get assistance with their Medicare costs. With Medicaid, you can also get lower prescription costs also. Social Security also has a program called Extra Help. This was mentioned a little earlier. With the Extra Help program through Social Security, again, those with lower income and assets or resources can get help to pay for their Medicare Part D premiums and deductibles and the cost of their medications. The Extra Help program does not help with payment for Medicare A and B related costs. There is also another program called the Medicare Savings Programs, which was mentioned a little earlier also. The Medicare Savings Programs are programs that assist people with lower income and assets, excuse me, who need assistance with paying for their Medicare Part B and sometimes Part A monthly premiums. That these programs can also, in certain circumstances, assist with payment of Medicare Part B and Part A co-insurance and co-pay costs. To apply, you can either go online to
to www.access.wi.gov, or in Milwaukee County, you can call the Milwaukee Enrollment Services at 1-888-947-6583. These programs are available for everyone to get assistance. So let's delve a little deeper into extra help. Extra help through Social Security helps pay for prescription drug costs. Social Security makes a determination once an application is submitted on how much help a person can get. Some groups can automatically qualify to get extra help. Those who have Medicare and Medicaid, those who are on SSI, and those who are on Medicare savings programs. These programs give you automatic coverage for extra help, or as sometimes called, low income subsidy, to help pay for your Medicare A, B, and D copays and coinsurance costs. To get extra help, you or someone that you have designated as your authorized representative can apply for these benefits for you. Next slide, please. So what are the Medicare savings programs? As I said earlier, these are programs that can assist you with Part A and or Part B premiums, co-pays, co-insurance amounts. You apply through Medicaid for the Medicare savings programs, and there are different incomes and asset levels that qualify you for different levels of assistance. Also, these income and asset levels are changeable. They do change every year. They are based on the cost of living increase that everyone knows about, that we get every year from the federal government. So these are not set in stone. These income amounts can change every year. So there are programs out there that can help you. There's a program through the Social Development Commission, which will help people obtain free or low-cost prescriptions. For those of you who may not think you qualify for any of the other programs, you can go to the Social Development Commission, and they can see if you qualify for their program for prescription advocacy and referral services called the PARS program. You can call SDC at 414-906-2306 for assistance.
Now, Ginger, before we go on, you mentioned that there may be individuals who receive both Medicaid and Medicare.
Yes.
And this would, if I'm a person with a disability, could I be one of those people that receive both Medicaid and Medicare? And if so, how does my insurance benefits work?
Well, for those Medicaid, most people who are on Medicaid can recognize this because they have what is called a white forward health card. Some people know it as Badger Care, as I said. Some people see it as know it as Title 19 or medical assistance. If a person is eligible for both Medicare and Medicaid with the white forward health card at the same time, they can get coverage of all of their Medicare Part A and B coinsurance amounts and deductibles. They can get lower copays on their medications, coverage of their Medicare Part D premiums and deductibles. This program is there. These people who have both of these have very, very good coverage, and they get the best coverage and the lowest cost. for their medications and their doctor's laboratory x-rays on coverage also through Medicare.
Now, I just have one more question. I had heard from an insurance agent that there were special needs plans and that those were different than regular Medicare plans. What are special needs plans, and should I enroll in one?
Special needs plans are for those who meet certain criteria. There are a number of different special needs plans. These special needs plans are Medicare Advantage plans, such as Nina talked about Medicare Part C, Medicare Advantage plans. These plans, if you meet their criteria of, say, having both Medicare and Medicaid, or certain cardiovascular disease, medical conditions, or in now, starting in 2020, end-stage renal disease, special needs plans. These plans can assist you with lower costs. They can cover many of the things that some plans don't, some Medicare Advantage plans may not cover. But for special needs plans, it is very important that you meet their criteria. If you do not meet their criteria, you may not enroll in that plan. So if someone says, I want to, you may be eligible for that, for a special needs plan, then you need to question, how am I eligible for this? Do I meet the criteria for this? Also, remember, with special needs plans, just like any Medicare Advantage plan, they are usually HMOs, and that means you're locked into a network. Once you are locked into a network, if you enroll into any Medicare Advantage plan, if your medical providers are not in that network, you may have a problem with getting the care that you need. So special needs plans are there for those who meet certain medical criteria, certain other coverage criteria. Like I said, for Medicare and Medicaid, you have to be very careful to enroll in those and make sure that you ask about, how am I qualified for this?
Thank you very much, Ginger.
You're welcome.
Okay, so I'm going to turn it back over to Nina Yang to talk about Senior Medicare Patrol.
All right, thank you, Dan. So the Wisconsin Senior Medicare Patrol, it's a program that basically assists, educates beneficiaries, caregivers, and families to protect and detect and report any fraud. As Medicare beneficiaries, it's very important that you do protect your personal information, so that with your Medicare card or with your Medicare number, that you are receiving the care that you have received according to the Medicare summary notice or your explanation of benefits. If you do find anything suspicious on those claims, it is important for you to report that. And if you would like to report that, you can report it to the Senior Medicare Patrol, and their toll-free helpline number is 888-818-2611, or you can email them at smp-wi@gwaar.org. And then key points to remember during our presentation is Medicare is a health insurance program. It is not free. There are costs to Medicare. And there are many ways to get coverage within the program. As well, there are programs to help with individuals with limited income and resources. And SHIP and Medicare counselors provide free and objective assistance to navigate Medicare. Next slide. And then for more information or for assistance, please call the Milwaukee County Aging Resource Center at 414-289-6874, or you could go onto the website at county.milwaukee.gov/aging. Also, Senior Law Elder Benefit Specialist at 414-278-1222, as well with Disability Rights Wisconsin Medicare Part D helpline. You can call 800-926-4862, or you can go onto the website on drw.org or email medd.drw.org, and the Wisconsin Medigap helpline at 1-800-242-1060. And then for additional federal resources, you can go to cms.gov or the medicare.gov, as well with calling Medicare at the 1-800-Medicare number, and with the Medicare New Handbook to look at that resource guide for more information about Medicare. Thank you so much for everybody who came to attend today's presentation to learn about Medicare, and also about today's special topic about special circumstances.
Great. Thank you very much, Nina. Special thanks to Ginger Rogers from Disability Rights Wisconsin, who helped us out today. And a special thanks to Amos Bisa from our Disability Services Division, who explained many different ways you can become eligible for Medicare, even if you're not necessarily turning 65. So Amos, thank you very much for your presentation as well. We do encourage you to contact the Aging Resource Center in Milwaukee County for a host of different information. If you are an individual with disabilities, you can also contact the Disability Resource Center, and you can utilize that same number and get in contact with a disability specialist. So again, thank you for your attention today. If there is anyone on that has or is called in who has any questions, I'm just going to pause for a moment to listen for any questions from folks who may have joined us today. And you can unmute yourself if you are on the phone by using *6, or if you're online by pressing the microphone icon on the bottom or top of your screen. Okay, so I don't hear any questions from folks who have joined us. Again, I want to thank you for taking your time to listen in to today's presentation. This presentation has been recorded and will be posted on our Medicare 101 website on the Milwaukee County Division on Aging website. Just search for Medicare 101. Thank you very much, and hope you enjoy the rest of December and have a happy holiday season.